I don't love the term kissing spine. I think we really need to call it back pain. The problem that we have with kissing spine in particular is you can take an x-ray and you'll find changes within spinous process. And it's very easy to say, okay, well, we're done. We have a diagnosis. We have kissing spine. But is that really why the horse is exhibiting those behaviors? Is that really why they have poor performance?
This podcast is brought to you by White Griffin and Equilibrium Products. Hello, welcome back to Season 3, Episode 2. How's it going, Miri? How's your week been?
Yeah, pretty warm. I just swatted a fly away as we literally started recording. If you wondered why I was wafting my arms around above my head, that was why. It is roasting in the UK at the moment. It's like 31 degrees, so...
Yeah, super hot.
Super hot, super hot. How are you? How's your week?
Week's been good. I still have a cold because we're actually recording this 5 minutes after the last podcast. It just so happened that they fell together. So it's not that I've had a cold for a week. It just in podcast land, the time hasn't really moved on.
Not just like a sickly human that lives in an immune suppressed state all the time.
Yes,
that would be a shame.
It would be. It's been an interesting couple of weeks, and I was talking to Miri before we joined about whether I should talk about this, and we decided to lean in. I had a couple of, they weren't difficult rides, but a couple of rides where I didn't really enjoy it. I took Harley out to a venue called Speedgate for some unaffiliated dressage, and it's quite a spooky venue, and the tests happen in a 60 by, 40 by 60? No, sorry, what am I saying? 20 by 40. All the numbers.
The snot has made it into your brain.
Yes, it was causing all sorts of problems. What a lovely image.
Sorry.
And so it basically the arena that you work in goes right to the edge of the actual arena, and there's a big banner and there's all sorts going on. And he just found it quite hard, and there were a couple of the movements where I couldn't quite get him in the right place, and we got sort of quite low marks on a couple of movements, and disobedience was written on my test, which I know it's part of the...
It?
Yeah, I thought that they were replacing it with harmony, but... Or obedience was being replaced with harmony, but I guess she had to write something to say why she gave me 3.
But
right, anyway,
because they could write lacking harmony.
Yes.
Which is better than disobedient, because disobedient makes me think I don't know, a dog jumping up, you know?
Yeah, which also just doesn't paint a very nice picture. But anyway, it was fine. He was very good on the ground. And so the week after, I was supposed to go back and do affiliated competition, and decided that we weren't going to get anything out of going back to the same venue and having the same experience, essentially. So instead, I booked a lesson, and it just was one disaster after another. So they moved the venue from one place to another. And they'd given me these instructions to avoid the ULEZ,
which is that was thing around London to make you not be able to drive vehicles into London in case you're
a low
from the UK.
Yes, it's like a congestion charge basically for lorries and things. So that was quite stressful because I couldn't work out whether or not I was avoiding the ULEZ or not, which means I ended up paying it anyway. And then I got to this yard, and it turns out that when you type in the name of this yard that I was trying to get to, it brings up another one on Google Maps. So thankfully I was really, really early, but got there, had to open the gates, shut the gates by myself. I was on my own, got there, and these people were I was here for a lesson. They were great. I was where should I put the lorry? And they gave me the hardest spot to park in. If you picture a barn with a 7.5 ton lorry at the end of it, around the back of the barn is quite a tight space with a bunch of cars parked, including a big Tesla. And then on the other side of the barn is a huge pile of wood chip. They wanted me to park past the 7.5 ton, round the right corner, past all the cars, and then by the wood chip. So I did that, got out, realised I was at the wrong yard, then had to reverse all the way back past all these cars, round the corner, past the 7.5 ton. And I was it was 3 people drinking tea, not a single person got up. And I was I know that I'm at a nice yard, but I did not expect people to literally
not having a lesson here. Bunch of
bummers. Well, yeah, I was oh, have I got much room at the back? And they just sort of leaned over and went, not loads. And I was great, thank you. That's really helpful. So anyway, was quite stressed by this point. Got to the new yard, had to back into the new yard as well. And there was quite a lot of stuff everywhere, and that was quite stressful. So I had 5 minutes at this point to get tacked up and gone. And Harley was incredible. in fairness, he was so good, but I felt a bit like, you know when you feel a bit shaky when you've had a kind of a near crash experience? I felt a bit like that. And so I did say this.
Should have had.
I should have done a somatic shake. I know. In my head, I thought, have I got time? And isn't that a silly thing? But I was like, maybe I haven't got time to have a shake. But anyway. And then the lesson, she was really nice, like objectively really nice. But I just think I was a bit over my threshold. And in the beginning, she kind of was picking up on little things, like she was like, don't, you know, pat with the outside hand and don't do this and don't do that. So I was feeling a bit sort of under pressure. And then towards the end, we got some really nice work, but then towards the end of the lesson, we were doing an exercise that I just felt would be too difficult for us. And it was really like quite difficult. And I did say before we started it, I was like, oh, I think this might be a bit of a challenge, especially the outside bend that we're trying to achieve. And she was like, you know, just humour me, whatever. And so we did it, and it kind of fell apart. And she was like, you're just overthinking it, like, let's keep going. And I was just getting progressively upset. And just, I'd already been feeling not very good after Speedgate. And I was like, you know, I can't do this. I was like, I really can't do this. And she was just kind of, I think she was trying to sort of be encouraging, but in a different way. And Harley was struggling. Yeah, and like Harley was struggling, and that made me feel really guilty afterwards that I didn't say like it's not just that I can't do it, he's struggling too. And anyway, I'm keeping it really vague, but after she like ended the lesson, I was warming him down on my own, and she'd gone to get a horse in, I think, and I just like was nearly in tears. Like I just felt so not good about the whole experience. And I spoke to a friend about it afterwards, and I was just like, I actually put something on my story, and I was like, I just feel like a really bad rider, and I've got all these horrible internal thoughts about how bad I am. And my friend was like, I think you have to get out of this place. It was such good advice. Out of a place of defaulting to thinking that when stuff goes wrong, it's immediately because you're a bad rider. And she was like, in this case, the answer was not, you are a bad rider. The answer was, this is above our training ability and where we are right now. And I thought that was a really useful bit of language and ammunition for my next, and if you've ever been in this position, for my next, you know, coach interaction, if I think this is too hard. I mean, I did literally say, I had my head in my hands and I was like, I can't do this. But I think actually being able to take the emotion out of it and say, this is above our training ability, and we need to simplify this exercise.
I don't feel comfortable putting my horse in this position. Yeah,
exactly. So, you know, it's all good learning, but it was a little bit tough.
Yeah, and it's not, it's never failure, it's feedback.
Yes.
You know, like you didn't fail at something, it was just feedback of the situation of, I was already in a bit of a negative headspace. I then went and trained with a coach who didn't know me. You know, some people really thrive on being pushed a little bit in those moments. Some people really, they're like, okay, a challenge, and they can see it as, oh, well, it wasn't perfect, but that's okay. Whereas I know that you are very protective of his peace and his abilities and also his confidence. And I think it probably, you know, there's a lot of like, you're very quick to be concerned that you might be doing the wrong thing. And that's not a judgment in a negative sense. It is a case, you know, that is a reality for you guys, and it's a real superpower, because it means, you know, I've said before how like pragmatic and wonderful you are with his ability and your space as well. And I think sometimes we have to go and have those experiences.
Yes.
To go, okay, we're not quite there. I have definitely experienced similar feelings with coaches before, where I felt like something was like just not really like comfy for me. And I think that comes from building your own, you know, like understanding of what feels good and what way you like to do things. And obviously that's why you have such a great relationship with your coach. And it was do you remember we had this conversation that you and Hannah had about, and something that she had said about, she finds it hard sometimes when people go out and train with somebody else and they undo a lot of stuff all in one session. And I think unfortunately this is part of it, because you might have gone and had a session with somebody else and been like, Hannah, it was life-changing, she brought this to the table, this was so cool, this, she really brought out this side of Harley, and I loved that we did this, can we try a bit more of that in our training? It could have gone one of two ways. It just unfortunately happened to go the wrong way, and you've learnt things you don't like and things you don't want to do.
Yeah. And actually, I think it is one of those moments where sometimes I think people imagine that they won't get on with a coach because it will be a horrible, really horrible scenario where it feels abusive, or the coach is being really horrid, or something feels really really wrong. And actually, in this case, she was perfectly nice. It was, you know, she was definitely trying to coach me in the right way, and she was picking up on things that I struggle with, and I think she genuinely thought it was the right approach. Obviously she did. And she tried to simplify it in her own way, but you know, not every coach is for every rider.
No, and it might have been that on a different day, having not had the week you'd had prior, it would have been different. But yeah, I mean, you know, your safety was intact and no bad experience really came of it, other than having a bit of a patchy session. You know, I think that's important to remember, isn't it? Like, how bad really was it? Was it really bad, or was it like actually just like okay bad, and we're going to learn from it and not repeat it?
Yeah, totally that. And I've been chatting a bit with a mindset coach who reached out and wanted to do a bit of work together, which I'm really excited about actually. And I've been taking her, she's got an online masterclass, and so I've been reading through that before we talk next week, and just hearing about just simple things like not rewatching when things go wrong, like over and over again, and not like dwelling on that. Basically, you're teaching your brain what you want to see. If you continually show rewatch videos of yourself like falling off or like things going wrong, it's almost like you're teaching your brain that that's what you want to happen.
Yeah, and it's also just, like re-traumatizing yourself.
Yes, which is really interesting. So I'm excited to share updates on that when I.
That is really interesting, and it's an interesting kind of concept. So I look forward to hearing more about how you get on with her, and no doubt as you work together, maybe you will share her details with us if it works out, which would be interesting.
How's your week been?
My week's been good. I wanted to talk a little bit about my like anxiety and stuff, because since we've had a gap, my anxiety was really bad again, like really struggling. And I've talked about this if you're just coming to the podcast, I've talked about this a number of times over the last sort of year, but I think it's pretty much my hormones that are driving it. And I shared on my story a while ago, a couple of weeks ago, when it was, you know, I'm waking up every morning feeling very anxious for no reason, just waking up feeling like everything's going wrong and having a lot of rumination, which is interesting that that's similar to what she was talking about, this sort of like going over and over things. And I essentially was doing that, like going over and over big existential questions in my head all the time. And I posted about it on my Instagram story, and when I didn't just get a few messages, I got hundreds of messages from women. Hundreds and hundreds and hundreds. And I know you and I have spoken about our hormones a little bit, and, you know, I know that you notice a change a couple of weeks before your period, that kind of thing, like feeling more emotional and less capable of handling normal stuff. And I spoke about hormones, the link of hormones and anxiety, and feeling like dysregulated, and waking up feeling difficult, and waking up in the middle of the night feeling like your heart rate's going really high and stuff. And I just want to say, like, on a wider platform, you're not alone. I am not alone. I'm one of thousands, and I think that women's hormones are so commonly just completely disregarded as a thing. You know, you go to the doctors and you say, I'm having heavy periods or something, they're like, here is the contraceptive pill, you know. And it's just kind of like a plaster, right? Like, why are we all struggling? I wrote a post yesterday about it, and I said, like, are we did the women in the yurts, you know, did our ancestors struggle with hormonal dysregulation, or did they just pass through life, everything was relatively straightforward, everyone had their period at the same time, everybody just kind of flowed through as a community? I don't know, it's It's a funny one, and it's seemingly so common, and I just think I'm doing something about it actually at the moment. I did a hair test last week, and I had a call with the people from the hair test. So it's called bioresonance, but it's similar to homeopathy. They offer you remedies and like supplements to take, and a lot of stuff around my gut came up, interestingly, but also around my thyroid, and that's hormone regulation and stuff. So they've suggested a few different things, and it's not really relevant for me to tell you what they've suggested because it's also specific to every person. But I'm really working on it, and it's a funny thing. When I'm feeling like I'm feeling, I don't even know that person who feels the other way. And then when I am her and I'm struggling so much day to day, I can't imagine my life without feeling like that, and it's really hard. It's been rubbish.
That is hard.
But I did go to Red Wings. We did that, and I was really proud of myself for that. And there've been some really good times. So we are keeping on going. We have a really cool guest this week. So she's actually a friend of mine. Her name is Daniella Vansteenkiste. I hope I've said her name right. No doubt she'll correct us when she joins us. But she's a neurologist, so a spinal specialist. And I think in humans we talk about brains, but I don't know if in horses we talk about brains. But she's a vet, and I knew her from when I was on a big yard and we used to jump together and stuff. So I've known her for a really long time. And she helped me a lot, actually, when Ralph had his spinal problems. So, yeah, I'm really looking forward to this conversation. I hope it's going to be really interesting. We can talk about back pain and kissing spine and all sorts of things like that.
Yeah, I'm so looking forward to this. It does feel like everywhere I turn, or in my community, kissing spine in particular is a really hot topic and one that people want to know more about or have struggled with personally. So I'm looking forward to hearing from Daniella. Before we dive into that conversation, a huge thank you to Equilibrium, who have sponsored today's podcast. They feel like such a good fit for this episode because one of the products I love most from Equilibrium is the Heat Sense massage pad. It's been reliably tested with therapeutic heat output with sensors to turn the heat on and off depending on your horse's temperature. There's heat in the back third of the pad to target the most common areas of weakness, and it fits into your daily routine with a 30-minute program and 6 massage motors. Now, I would like to say, I'm sure she won't mind me saying this, somebody on my yard actually went through kissing spine surgery twice, and when she was looking at ways to help support her horse afterwards, she borrowed my massage pad and she saw such a good effect from it that she went and bought her own, and she uses it now pretty religiously as part of her routine. And it's definitely not the first time that I've heard that from people who are managing their horses' backs in a new way. So I think it's a great bit of kit, and if you're interested, then Red Post actually does a trial of these so you can try it out before you fully commit. And the other thing I just wanted to tell you is that we've heard Equilibrium are launching a new product in their therapy range this autumn, so stay tuned to find out what it is. We will link to Equilibrium in the show notes so you can go and check them out for yourself.
Welcome, Daniella, to the podcast. I was just trying to work out how long we've actually known each other for, and I think it's too long to know that. I was like, I don't know, 18, 19 when we met. I'm quite old now, so.
Whoa!
Yeah.
How did you guys meet?
We actually worked together at a show jumping barn in the UK. So I was in vet school when Miri and I met.
Yeah.
Oh my God,
and Daniella used to come and like
cool.
ride with us. I worked there full time, and Daniella used to come and help out. And every now and then, if somebody turned up that was really useful and could really ride, then my boss would be like, "Come along anytime you like and help out." So that was how it happened. And then we used to spend quite a lot of time together. So yeah, I was a wee baby then, but.
I know, I used to teach on the riding school, and then they're like, "Oh, you want to ride?" I was like, "Yeah, I definitely do."
Yeah, love that. It was a great place, wasn't it? We learnt a lot together. We're here to talk about your life as a veterinary neurologist. Can you start by just introducing what that is and maybe how and why you got into what you do?
Absolutely. So I am a full-time small animal veterinary neurologist. And actually, when you take your board examination, it is for veterinary neurology in general. So we do study both small animal and large animal. But large animal is sort of becoming more popular now and wasn't necessarily as popular when I qualified. But I actually went into vet school wanting to be an equine surgeon. So I've always had sort of the horses as a very large part of my life, and really thought I wanted to do that professionally as well. And as I went through vet school, I started to realize that I really enjoyed the small animal side as well, and spent some time in some big equine clinics, and then actually came to the States for a neurology rotation. And I was like, oh my gosh, this is amazing. So what's really neat about neurology is that there are sort of two components to it. There's the medical side and the surgical side. And in people, you might be a medical neurologist or you might be a neurosurgeon. But in the veterinary world, we get to do both, which I really enjoy surgery. So that was like really attractive to me.
That's really badass.
Yeah. It's a lot of fun. But what's nice about neurology and neurosurgery is that we don't necessarily do like as many surgeries as like a general surgeon or soft tissue surgeon or orthopedics, for example. And so you get to be like very good at the like handful of surgeries that we do. Which I really liked. It's not like the same person is, doing stomach surgery and, fixing a broken leg. So it's very niche, but it's really fun.
And what are the kind of the set of surgeries that you typically do as part of your job?
Yeah, so as a small animal neurologist, I do a lot of spinal surgery mostly. They're called a hemilaminectomy is probably the most common, as well as a ventral slot, which are procedures that are used to treat intervertebral disc disease, which we see a lot in dogs.
Which is what Ralph
Miri. Yep, exactly.
Oh,
Yeah.
IVDD,
yeah.
to make it into layman's terms.
Is intervertebral disc disease. Yeah.
So that's so basically Ralph had like a bulging disc essentially, but in small dogs it's much more serious than a bulging disc in a human. And the disc comes all the way out of where it should be and then presses on the spinal cord, and then it stopped his back legs from working, made him incontinent. It was terrifying. He saw an amazing specialist at Davies, and with Daniella's ongoing WhatsApp support, we made it through. So that was
And it's really interesting that you mentioned about like disc bulge, because disc disease in dogs is very different compared to dogs and actually horses too. Because if you think about it, they're on four legs, whereas we like stand. So we're, bipedal and they're quadrupeds. And they tend to get more than just a disc bulge. It's called a disc extrusion, or the way I explain it is almost like a disc explosion, where they basically like do something that they shouldn't, and then that disc explodes into the spinal canal and compresses the spinal cord, and that's a surgical emergency. Versus like a disc bulge, which like you're gardening and you're putting wear and tear on your spine, and it's like very gradually degenerating and over time becomes bulged. That is not like a surgical emergency.
That's really interesting to know the difference. Does that sort of thing, is more common now?
Disc extrusions are common, and I would say they're maybe more common because of our choice of dog breeds. So it's called chondrodystrophic dogs. So your dachshunds, your Frenchies, corgis, beagles, bassets, basically long dogs, short legs. And they are prone to like premature disc degeneration, which then leads them to being at high risk for disc extrusion. So with the Frenchie becoming more popular, I think we're just seeing more of it too.
And what about with the horses? What are some of the most common issues you see with your equine patients?
Yeah. So disc disease is actually still very much up and coming in horses. So part of the problem is that we can't image horses the way we do in small animal or people. So if you have back pain or a dog has back pain, you'll go in and you'll get an MRI and we'll know exactly what the problem is, exactly what location in the spine. Whereas in horses, we don't really have that ability yet. We are able to do CT scans of their necks, which are great for bony changes, but not so ideal for soft tissue changes. And as the quality of our imaging improves, we are starting to see changes within the disc. But it's important to understand that discs are, when they're healthy, they're hydrated. So it's like a soft tissue. So you're not going to necessarily see changes on the CT scan. So we think that it's more of a disc bulge and more of a degenerative process, but we don't have the ability to like diagnose it the way we do in dogs and people yet. So I definitely think it's an up and coming topic of discussion that we are realizing maybe has a bigger impact on the equine spine than originally thought, because I don't think anybody was talking about disc disease 10 years ago.
No, that's really interesting. And I think ultrasound is quite an important tool in what you do. Is that something you use?
So I actually don't really use ultrasound a lot because my full-time job is small animals. So I use the MRI a lot more. But in horses, ultrasounds of their backs is becoming, more and more advanced. And we can see a whole lot more with ultrasound of the individual muscles and ligaments and joints. Now, unfortunately, you're not really seeing a whole lot of the disc. This is, again, there are some studies looking at like transrectal ultrasound, so where you put it up in the rectum to look at the like lower back, to look at the discs from below. But there's like several inches from the top of the horse's spine down to the disc. So we still don't have like a great way in the like thoracic or like, shoulder and lumbar area.
So I think it's probably relevant then to say if we don't have particularly good imaging, like you can take x-rays to look for kissing spine, things like that. You can use ultrasound to look at the supraspinous ligament to see any injuries and stuff. Why is this such an important topic? And why is there a specialism in neurology? Like, what is it that you're seeing? Because I know when we preambled this, you kind of wanted to talk about back pain and doing inverted commas. Like, why is this such an important topic of conversation for horse owners?
Yeah, I think that we see a ton of back pain in horses, and we don't have accurate diagnoses for the back pain. And I will say that, like, I see back pain every day in my canine and feline population. So I see it a lot. And I do think that there is this shift in equine medicine to start looking at horses from the body down. Like, when you go to vet school, or even if you guys have ever gone for like a lameness evaluation, a lot of times veterinarians are looking from the hoof up or the foot up. And I think that there's a lot that's being missed in regards to horses' spines and bodies. And this is a thought that I sort of had just with what I do on my day-to-day basis. But I worked with Dr. DeClue, and she is, doing a lot of work in this area and sort of opened up my eyes a little bit to it as well. And I think there's a shift that's happening right now in veterinary medicine, but I will say, like, generally back pain in horses is not necessarily being diagnosed by neurologists. It's usually your sports medicine practitioners, sometimes surgeons, or, whoever's doing your poor performance workup, basically. So my goal is to bring a neurologist perspective to back pain, and hope to include some of my area of expertise with neurosurgery to sort of help these horses moving forward.
And can you tell us a bit about what that looks like? Like, how are you doing that?
Yeah, so I recently started a consultation service for horse owners and veterinarians. The website should be launching very shortly, or hopefully by the time this is released.
We'll link to it in the show notes.
That'd be great. But I think that, in regards to assessing these horses, it is trying to identify back pain sooner, and pain just in general, because I think back pain is present in a very large percentage of performance horses. And I think, we sometimes sort of push it aside until it really becomes a performance issue. And if we could get better at identifying it sooner, whether it's your primary problem or a compensation issue, then, that would be a huge advantage for our horses, and honestly would probably lead to less time off if we could find it sooner.
You touched on something really interesting there about is it the original problem, right? Like, does it start in the back? Can you talk a bit more about what you mean by that?
Yeah. So, we know in people that often the primary injury isn't always like the source of pain. So you have an injury, you rest, you're inactive because you have an injury, and then that can lead to secondary pain. Like, I don't know if you guys have experienced this, but like I've hurt my knee, I stop exercising, I stop working out, and then my hip hurts because I'm not active and I'm not moving my body. And so then you have a secondary pain, and that can lead to, changes in your posture, or you might stand a little differently to compensate for that injury. And it's really that repercussion on the rest of the body. And so when you look at imaging or diagnostics, the abnormality on that X-ray, CT, or MRI does not always correlate to where you're painful, or what that cause of the pain is.
So I guess this brings us onto the topic of kissing spine. It's something that Rhi spoke about a number of times. She's had people on her yard that have experienced kissing spine and kissing spine surgery. I'm thankful not to have experienced it in a very big way, I suppose. No major... Well, actually, what am I talking about? One of my own young horses has got congenital kissing spine, and I can't ride her. I've experienced it in a very big way. So my young horse, Dee Dee, she's 6 now. We noticed some girthiness when she turned 5, when we were tacking her up, and she never ever was anything other than a bit grumpy, and never funny to get on, nothing like that, but found canter really difficult. Those were the kind of two symptoms that she had. And I didn't push her. I had one training session where I kind of went through it a little bit, and looking back, I'm like, that was not good at all. And even then I wasn't tough, but I was like, come on, let's try and work through this a little bit. And looking back, it was very obviously a pain signal from her. But, and yeah, it turns out, anyway, took spinal x-rays, and her spine basically nearly fused. So we may re-x-ray again when she's fully grown, when she's probably 7 or 8, and see whether the spine is completely fused. But I think, can you talk a bit about kissing spine and what you see, why it happens? Maybe that's a good starting point.
Yeah, I think I don't love the term kissing spine. I know it's a very everybody loves that word, right? It's
quite easy, right? It seems to explain quite well what's going on. Kissing, spinal processes. Touching.
Absolutely. Yeah, exactly. It's a very obvious word, but I think we really need to call it back pain, because we know from studies that the area of impingement of the spinous process, your kissing spine, does not always correlate to pain, and is not always the problem. And I think the problem that we have with kissing spine in particular is you can take an X-ray and you'll find changes within spinous process. And it's very easy to say, okay, well, we're done. We have a diagnosis. We have kissing spine. But is that really why the horse is exhibiting those behaviors? Is that really why they have poor performance? As you said, there are some breeds, thoroughbreds in particular, where we see a high incidence of congenital kissing spine. And those horses will go on to, have a good, life, whether that's racing or performing. They can perform with those malformations. And I will preface with saying that I, again, practice full-time small animal. I consult on the equine side. I do not do the surgery for kissing spines in horses personally. But I think it is just one of those diagnoses where when we find it, we need to ask ourselves, is that really truly the problem? And so if you don't mind, I would probably start with what can we see with horses with back pain that then might lead you to a diagnosis. And some of this stuff is obvious. Some of this stuff, especially if you've had a horse with back pain, you might know. But I think performance issues is a big one. So resistance under saddle, bucking, hollowing through their backs, reluctance to go forward. The canter seems to be especially most affected. And then we have behavioral signs. So ear pinning, tail swishing, girthy behavior, irritability. I know that we've talked about this before, but like she's marish. Maybe not. Postural changes, like they might hold themselves differently in their stalls. You might notice that they like always point one leg forward or one leg back. They may have like a very narrow stance in their back end. And then, once we're starting to notice some of these signs, is like starting with more of an examination. But honestly, horse owners can do this at home is, can you palpate your horse's back on a daily basis and know what's normal for them and know what's not normal? And then now we can determine, is there pain there? Is there any like muscle spasm through their spine? And you can start at the withers and go down to the tail and, feel along their spine, because muscle should be like soft and doughy with a little bit of tension to them. But if you're putting pressure and that horse sinks and sort of arches its back, like that's an abnormal response. So I think once you have signs of back pain, then it's sort of, okay, like now what's the next step? And if we catch it early, maybe it's physiotherapy, maybe it's chiropractic care, maybe it's acupuncture. Like there are body modalities that can help, horses with back pain. Like they may have worked hard and they might be a little sore, and it's as easy as that. And I think that's sort of a big part of my goal is like, can we recognize this sooner so we don't get to the point of more severe injuries? And not that this is going to like stop kissing spine changes, right? But just establishing a normal baseline in horses.
You know what we don't talk about enough in the horse world? Water. Not puddles in gateways or soggy fields, but where our water actually comes from, how we use it, and what happens if it starts to run out. Because honestly, we're already starting to see early signs of water shortages, and it's going to matter a lot more in the years to come. From filling troughs and soaking hay to hosing off horses after every ride, our yards use a serious amount of water. But clean, accessible water isn't a guaranteed resource anymore, especially as we face hotter summers, more unpredictable rainfall and growing pressure on the UK's water systems. The reality is, water is no longer the unlimited resource we all grew up thinking it was. And in equestrian sport, especially disciplines that rely on irrigated arenas, perfectly maintained grass, or frequent travel, we're going to feel the pressure more and more. Transporting water, paying higher bills, even having water use restrictions, it's not if, it's when. I'll be honest, I didn't totally understand how water shortages would impact horses long term either, but the more I've learned, the more it makes more sense to start thinking ahead now. That's why this episode is proudly sponsored by White Griffin, as is the whole of Season 3. A team doing incredible work around sustainability in the equestrian space. They help yards, businesses and individuals make more conscious choices, and water use is a huge part of that. So, here are a few small, practical things that you can try on your yard. Harvesting the rainwater where possible. Even just a couple of well-placed water butts can make a difference to things like yard sweeping, washing feed bowls, or even watering the arena. Rainwater harvesting is going to become a very big part of water and sustainability with our horses. Fixing those leaks. Dripping taps and old hosepipe fittings waste so much more water than we realise. Being mindful of hosing routines. Could a bucket or sponge do the job instead? Of course, welfare has to come in and you must do the right thing by the horse's welfare, but I do think that sometimes we could be using a bit less water when it comes to those situations. And finally, if you can, track your water bill. Well, become aware of the water bill. Knowing what you use is the first step to knowing what you could change. These aren't about going without, they're about getting clever. Because if we want a future where equestrian sport can still thrive, we need to be part of the solution. Thank you, White Griffin, for sparking these conversations and helping us all be better stewards of the land and water our horses depend on.
I'm really interested in this piece of the conversation, which is like kissing spine isn't always the problem, and that there are lots of not lots, but there are horses with kissing spine that aren't affected by that. So how do you tell the difference? What is the process of diagnosis? Like, if you find kissing spine, do you have a process where you're looking for other things as well, or you're trying other things before you get to surgery? Like, how do you differentiate when it is and isn't the problem?
Yeah, I think these horses need full performance evaluation. So full lameness exams, being evaluated honestly from an observation standpoint, like just out in the field, just interacting on cross ties in their stalls, to, a more traditional lameness evaluation where you are like, walking, trotting, lunging on the hard, on the soft, with and without tack. And tack is a big one. Like, these horses will move beautifully and, be very quote unquote sound. And then you put tack on them and they're like, oh, we can't function anymore. Or, even the horse's reaction to like having the saddle approach the horse. Sometimes you'll already start to see, pain responses and behavioral changes. So, yeah.
This is an interesting conversation, and I think one that we should definitely talk at as we are talking to a spinal specialist. There's been a lot of conversation around atrophy especially with these high level eventers. Mostly it seems to be a hot topic of conversation. Looking at you see these horses in the trot up, and the trot up has kind of become this like really popular thing to watch because everybody gets dressed up in a fancy outfit. But actually what it has done is it's really brought to light this pretty sad state of affairs when it comes to these horses' muscular top line. And these shark fin withers and this dip in front of the wither. Is this part of something that you are seeing and dealing with?
Yeah, so muscle atrophy is definitely part of it. I think a lot of these top line issues do come down to poorly fitting tack. I think that's a big part of it.
Someone had to say it.
I'm not naming anybody in particular, but I think tack is a big issue. And certainly even in my horses, I've noticed a very big difference into switching to, better tack that is better designed for the horse's way of going.
And I've totally been open about this before, talking about these the kind of French branded saddles. I'm doing air quotes, that are very closed in the head plate and super comfortable for the rider, but not really designed for the horse. And it's interesting that, the way that you put tack on the horse, like a saddle is helpful because it offers a structure for a human to sit on, because we have mentioned this a few times, horses aren't, I think actually when we were at Red Wings, we talked about how cows are more suitable to be sat on than horses because of the way their spines are built.
Yeah.
Not that I particularly want to go and ride a cow around the countryside, but it is...
I was going to say, don't ask me about cow anatomy.
Don't worry.
That's a long time away.
But it is interesting. And I even just saw an Instagram post the other day about how the spinal processes all face in a horse, like the first 14 face backwards and the back ones face forward. She's nodding. Yep. I'm getting my anatomy right. And we end up sitting on this point where is there a bit of a hinge point almost, like where they meet and are both facing different directions? Can you talk a bit about that, like about anatomy and saddles and where we sit, I guess?
Yeah, so the horse has about 18 ribs, and then usually about 6 lumbar process. And so the goal is to sit on the thoracic spine and to avoid the lumbar spine. The
lumbar spine being behind the saddle.
Correct. Yep. So you have 18 thoracic vertebrae and then 5 to 6 lumbar vertebrae behind the thoracic spine. And then you go into the sacral area. So the thoracolumbar spine, meaning like the chest and the lumbar area, like basically the barrel of the horse. There's a lot of like lateral bending there. And then the lumbosacral spine, you get more of like a flexion and extension. So the goal is to not be sitting past the last rib on, your horse's back. But I think a lot of it is, every horse is different, and it's trying to find the right setup for the horse and rider. And, I think that's where getting a qualified saddle fitter is really helpful.
I think I just want to clarify. So you're saying that we want to be sitting on the part of the spine that predominantly bends left and right, not on the part of the spine that sinks up and down. Is that right?
Yeah, I mean, it's right. I mean, you would never sit on the part that sinks up and down because that's like basically in their pelvis. But yes, you're trying to sit on the on the thoracic spine.
It's really interesting. Do you have any are there any personal reasons why you got into this? Any particular horses or anything in particular that kind of drove you in this direction, maybe?
Yeah, so I actually had a young horse when I was 18, 19 that I actually had to put to sleep due to kissing spine and really severe articular facet, like arthritis. And he was only 4, and I got him, and he was like an incredible mover. Like on the lunge, he was just beautiful. He made a beautiful shape over the fences. But as soon as you put tack on him, he was completely different horse. And he couldn't canter. He was always cross cantering. He would over jump, but really because he hurt. Like he would just like really exaggerate the movement over a jump, and then he'd land and be like, ah, and tail swishing. I mean, all the signs that we described. And I was going into vet school at the time, did not know what I know now, but we basically made the decision to retire him. And within 9 months, without the lack of consistent work, he lost all of his muscle and all of his top line. And it got to the point where he struggled to get down and get up because he just had such horrific changes within his spine. So that one definitely sticks out. That was a really tough time. And, as a teen, you know some, but you don't know enough. And, we talked about injections. He wasn't a candidate for surgery because he had so many changes at the articular facet, which is the joint between the vertebrae. And, in that case, saying goodbye was the kindest thing we could do. He was only 4 and he was a sport horse, and he would have never been happy just hacking around. He wasn't a safe, he wouldn't have been safe for a lower level situation. And so we tried to give him, a chance, but that did not work out. And maybe there were therapies that I just wasn't aware of at the time. Who knows? But again, from a neurology standpoint, I love the puzzle because especially in dogs, there's what we call neurolocalization, which is a fancy word. But basically with your exam, you can figure out where you think the problem is most likely to be. And then you can do imaging of that area to try and figure out what the problem is. And I love that sort of puzzle part of the neurologic exam. And a lot of it is observation and history. So listening to their owners talk about their dogs and talk about how they're behaving at home and things like that. So I always enjoyed that puzzle aspect to neurology, and then being able to find it and hopefully fix it. And sort of the equine consulting, during my training, so after vet school, I did what we call an internship, where you sort of rotate through all the specialties, similar to human medicine. And then I did a research fellowship. And then I did my residency, which is where you spend 3 years only doing neurology. So it's quite the path. But during that residency, I did spend some time with some equine specialists, and they're a handful of people that are double boarded in their certification. So meaning that they have both like equine internal medicine and neurology. And I got to spend some time with them and I was like, this is really cool. But what's interesting in horses is that a lot of the neurosurgery is being done by orthopedic surgeons. So sort of more similar to people and not like in small animals. So if I were to just do equine neurology, I'd miss a lot of that like surgical aspect. So that's why I really like small animal neurology.
I see.
But yeah, sorry, that was a really long roundabout.
No, it's great. It's great. We're here to talk to you. Don't worry. There was something that you said about kissing spine surgery, that the horse, when you were younger, wasn't suitable for kissing spine surgery. And I think that I talk to a lot of people about this kind of thing and like ethics of certain surgical procedures that go on in the UK, like the neurectomy, that kind of thing. We've talked about that quite a lot on the podcast. But what are your kind of thoughts around the different surgeries, the options that there are? Because I think sometimes people don't get the opportunity to speak to specialists about this kind of thing, and they go to their relatively, standard veterinary surgeon. Like you're saying, you're not necessarily speaking to a neurologist in those moments when you maybe really do actually need a specialist. So here is that opportunity. My horse has got mid-grade a surgical option has been offered to me for my horse. I'm just making a hypothetical thing. What's your take on that?
Yeah. So I would go back to what workup has been done prior to considering surgery. So one of the things that we didn't really talk about when I think Rhi, you asked about like how do we make this diagnosis, but you can do what we call diagnostic analgesia, which is where you put like a local anesthetic where the changes are on the x-ray, and you basically numb that area and look to see like, is the horse clinically improved? Because if you take away that pain, like the horse should look better. And so I think that can be an important part of, sort of the workup in terms of, is that truly the problem? Has that horse had an ultrasound of its back? Realistically, like you can take x-rays out in the field, but if you want really good spinal radiographs, you need to ship in to a veterinary clinic with a stronger x-ray machine to truly get not only the spinous process, like the spinous process are the tip of the iceberg. They're like the pointy part at the top of your vertebrae. And so what you're not seeing with some of these x-rays is like the bottom part or the articular facet, which is the joint between the vertebrae. So I think that, getting a really good set of quality x-rays from, the entire or as much of the thoracic and lumbar spine as possible, because as our quality of x-ray has improved, we're finding different things. And we honestly, I think we're still in a situation where we don't know what they all mean. So you can have like bony proliferation at the bottom of these vertebra, the vertebral bodies, and that's called spondylosis. We're still not sure exactly what that means. We see it a lot in dogs, and in dogs, they're not always clinically relevant. Like dogs, you'll take an x-ray and you're like, oh my gosh, this looks terrible, but they're still walking around, doing their normal dog duties. The difference obviously with the dog is you're not putting a saddle in a rider and asking it to like flex and extend and bend and jump and, so I think there's still a lot we don't know. But before considering surgery, I personally think of surgery as like last resort option. And I'll be honest, as a veterinary neurologist, I'm not a huge fan of the surgery. I think I can see why this surgery was described and trialed and is done, right? Like if you look at an x-ray and you see two bones that are close together, that look like they're rubbing on each other, then our human instinct is like, well, if you make that hole bigger, then they won't rub and then you solve the problem. But the reality is that the x-rays of these horses, 6, 12 months, 18 months down the line, that bone comes back and it is ugly. The x-rays post-op can be really ugly. And sometimes the horses are still clinically doing well, but that sort of goes back to your x-ray findings don't always correlate with the source of pain. And I do a lot of neurosurgery. We do neurosurgery for these acute disc extrusions, that are causing paralysis in dogs. And like, there's a lot of muscle dissection to get to the spine. Like, you have to cut through muscles and ligaments. And, I have done surgery on a dog and then have had to do surgery in the same location 2 to 3 years down the line. And when you go back in, like, it's a mess in there. Like, there's a lot of scar tissue. There's a lot of fibrosis, which is basically, the muscle, when it heals, like, it scars, basically. And these are like surgeries that are surgical emergencies. But I just worry a little bit about like the long-term outcome on these horses. And I think it does relieve the pain for some time and in a fairly like obvious way, right? Because you're like taking away that compression, but for how long? And so I think that we have some better options potentially. And maybe there are things we don't have answers to yet. But I think that if these horses don't improve with like rehab, meaning groundwork, building top lines, potentially injecting the areas with steroids or analgesics, pain relieving medications, and we're not seeing significant improvement, like, I think rehab is really where the answer lies rather than surgery. And it's hard because it's not a quick fix. Rehab takes months and is not always successful. And so I think sometimes if you're presented with, let's do 6 months of rehab or let's go in surgically and fix the problem, then, as a horse owner, like, nobody wants their own horse in pain. But I think we're starting to have this conversation more so even among veterinarians. I just went to a conference on literally the equine thoracolumbar spine. Like, that's for 2 days. That's all we talked about. And there was a veterinarian who said, I used to do like 40 to 50 of these surgeries a year, and now I'm doing less than 5. So, that's one practice in one state. Obviously, we need more data among veterinarians, but I do think that we are starting to realize that maybe the surgery is not a good long-term success.
I'm going to ask the dumb question for the everyday equestrian. I'm just curious, but I don't have the knowledge to know whether you can. Could you reasonably make a genuine impact to processes that are touching in a non-invasive way? So like with groundwork, with the horse working correctly over the back, like, is it possible to create space between processes that are touching, or is it more about managing the fact that you've got that and just kind of working around it as opposed to trying to change the quote unquote anatomy?
Yeah.
Rhi's doing a very good description with her hands, like moving her fists away from each other, like to create a physical gap.
Create space. Exactly. Yes.
Yeah.
Yes.
So like, it has been described, like, when we take x-rays of horses, like if you sedate them and they like drop their head and neck, that there will be more space between the spinous process. So like,
interesting.
Yeah. So, horses that are x-rayed awake and sedated, and I'm not sure if there's a study on that, but I know that that's like a general clinical impression.
I have a very small comment to make on this before you continue to talk about the impact of rehab. I had a horse that when we x-rayed her back, she had calcification on a couple of vertebrae. So there were gaps when we x-rayed, like you're saying, when the neck was down and the body was soft, there were gaps. Her spinal processes were really cleanly spaced, but there was ossification where it looks like bumpy on both sides of the vertebra. And what it was decided was that she essentially had like mobilized kissing spine. I don't know if this is actually a thing, but like you're saying, like when the horse is moving, the spinal processes touch, and so they cause this damage and this degradation of the bone. But then when she stood having an x-ray, oh, she's fine, no problem.
Yeah.
This horse had significant discomfort about having a rider put on. She would move very well in the tack. She'd had her neck down great. You sat on board, you know, really, and it was a horrible feeling. And she really felt very like, she felt definitely like there was a huge change just when you got on. And if you could help her then be soft again, she did feel better. But she was actually decided not to be a ridden horse in the end because she had so much negative connotation. Yes, we need to be able to put horses through an x-ray while they're moving, right?
Yeah. So it's interesting you bring that up. Like dynamic disease is very common in the spine, I'm going to say. So we know, for example, in the neck area, there are definitely changes, whether the horse's neck is in extension, in flexion, or in neutral. The degree of compression on the spinal cord will vary. I think, there are conditions that are, dynamic. We see this in dogs as well. Wobblers is sort of the layman's term, but you may have heard of it in the cervical spine, and that there's definitely a dynamic aspect to that disease. In dogs, we definitely have a dynamic, aspect to what we call lumbosacral disease, which is basically where the tail meets the lower back. So it's called the lumbosacral junction because it's the last lumbar vertebra and the first sacral. And actually that is an area in horses that we're starting to look at a whole lot more. So again, this is like the front end of the pelvis. If you're like looking at a horse, it's like it's continuation of her spine, but like about there, just in front of their hip area. You can't palpate it because it's like deep, obviously. But we're seeing more issues with like bilateral hind limb lameness, like those kinds of issues and discomfort in their hind end can be originating from that lumbosacral joint. So when we're talking about kissing spines, again, that's a little bit why I don't always love that term, is because if we circle back to like back pain, you can have kissing spines and lumbosacral disease, and you might have back pain, as your overarching clinical sign.
I think it's time to ask if you can give us some hope.
Yes, yes. I mean, I think
because you mentioned rehab, but
Yes.
because this is obviously, we have specialists in this topic, so it's obviously widely enough a problem that it's very common as such. What can we do? Can you give us some top 3, top 5 things that every horse owner can be doing to A, avoid it, but B, be aware of it?
Yeah. Again, I think like the easiest thing is just to know what your horse's baseline is. Like, are they comfortable in their back? And, if you don't feel comfortable palpating your horse's back, you can ask your veterinarian on how they do it. I'm sure there's lots of YouTube videos on how to palpate your horse's back, but really it's having like sort of a consistent feel of your horse's muscles and establishing what's a baseline so that when it's not normal that you can make a decision. There are lots of treatment options. Like, I definitely don't mean for this to be all doom and gloom, because the number of performance horses that are out there leading very full lives is high. Like, it is a small proportion of horses that become, essentially non-rideable or need to be retired due to this. And I think the reason that those horses have to become retired or non-rideable is due to chronic pain, and whether that's the kissing spine or something else. But if we can, detect pain before it becomes chronic, then that would, really be ideal. So, in terms of therapies, like it can be, what we call like systemic, meaning like medication. So like anti-inflammatories, like steroid injections. But basically what's really important is to treat what we call acute inflammatory pain, what I'll call like good pain. So, if you hurt yourself, it's painful, you don't want to use it, like that's helpful while you heal. Now, once it's healed, if you have chronic pain, like that pain becomes a lot harder to address. So that's where your bute and steroid injections can be very helpful for that acute inflammatory pain. And then muscle relaxants is another big one if you have a sore horse. So we use methocarbamol or Robaxin here in the States. I'm sure you guys have that in the UK too.
We've used Robaxin before on a horse, interestingly, that had neck arthritis.
Mm-hmm. Yeah, so that's a really good muscle relaxant. Not all horses respond to it. Like sometimes you have to use higher doses to see an improvement. And then we have, another class of medications for like what we call neuropathic pain, which tends to be more chronic. And so we'll use, yep, exactly.
I'm a professional.
Yeah. You've been through it.
I wish I wasn't.
But gabapentin, and then there's another one called pregabalin that is sort of up and coming in the horses. We use it in dogs. That can be good too. Now, it doesn't all have to be medication related, but generally if you've got a horse that's got significant back pain with abnormalities on radiographs, ultrasound, bone scan, however you've diagnosed whatever we think is causing the back pain, there is definitely a place for physical therapy and rehab. And I think focusing on these horses' posture is really important one, because posture is your first sort of step in terms of regaining a more normal movement pattern. And then, we talked about this a little bit, but like chiropractic work, acupuncture, I've had really good success with shockwave therapy. Now it's important with shockwave, you're only tackling the top part of the muscles. So they're called the epaxials. And then you have the muscles that sit below the lumbar vertebrae, which are called the hypaxials. And so shockwave will help with more superficial. So shockwave is really good for the more superficial aspect of back pain. But then core strengthening is important for these horses, lunging them with proper technique, which, I know, Miri, you focus a lot on. And really the under saddle rehab comes a lot further down the road. If you can't...
How far down the road?
Yeah, that's a great question. I think when these
horses... people need to hear this, because I think that sometimes the vets, in my experience... Very optimistic, very short term, 3 months, you're back on board, what is the...
I think it goes back to examining the horses and looking at the horse in front of you. So any horse can build a top line without being ridden. So if you don't have a solid baseline to get on, then I think we have to ask ourselves the question, do we need to get on? So building a top line is really important. Having a saddle that fits is really important, but your saddle is not going to fit until you can develop somewhat of a top line.
Yeah.
And so I think that timeline is really hard to say. But it's interesting because in this conference, they were actually talking about how as veterinarians, we need to start prescribing rehab therapy like we prescribe medications. You can't just say, oh, walk for 5 minutes, trot for 5 minutes for 4 weeks, and then, go from there. And there are veterinarians certifying in rehab. And I think if you have access to, someone like that, that can be very helpful. I think it's a lot of trial and error having rehabbed horses myself. Sometimes they look amazing and the next day they'll look really sore and then they look good. And it can be very hard, I think, for the average amateur owner to rehab their own horse because unfortunately, I think as part of the rehab process, sometimes you do have to push them a little bit. And it's not always nice, but it as well. If you go to the gym and you're rehabbing a knee or, an ankle injury, it's going to be sore for a while until you can develop the musculature to support that joint to then get stronger. And I found that even as a veterinarian rehabbing my own horse, I was like, oh, she doesn't look, I don't want to make her, trot harder, better. So yeah.
I know, Miri, you've done this, but on our yard as well, obviously, so I have my horse on full livery, Daniella with my coach, and she will quite often, if there is extensive rehab to be done, she'll be like, just hand the reins over to me for the first few weeks, because this is hard. It's hard for them, and you have got a lot of emotion tied up with it, and it can be really difficult, and it just takes the strain off the owner a little bit. And obviously the owner still wants to be part of it, but it can just, like you said, it's hard to push your own horse and see them struggling, and it can be helpful to have somebody objective to support you.
For sure.
Well, and also to understand the level of struggle, right?
Yes,
because
and
struggle is a very broad word potentially, and it's like that like, where is the comfort zone? You know, to go to the edge of the comfort zone is important, but not to the point of like, let's keep training a lame horse kind of thing.
Right. Yeah.
Yes.
And that's like looking for pain behaviors. Another favorite of mine is the pain ethogram. I don't know if you're familiar with it. That was designed by Dr. Dyson. But I think that can be a really helpful one. Is this
the 24 behaviors of pain or pain face?
We should maybe we'll put this in the show notes as well.
Yeah. It's being talked about more often these days. It's good.
Well, I think it's also a good one for like starting to recognize pain in our horses. You know, I think, again, like we could talk about this for forever, but it's like, what's behavioral, what's pain? And so I think it's been helpful to have a more like concrete guideline for horse owners to start, you know, evaluating their horses a little bit more closely.
I've got a question that I want to ask that's a bit of a kind of a closing question, but is there anything that we haven't spoken about today that you really would like to touch on before I ask that question?
Yeah. I think in terms of like the rehab is just get off your horse. Like that's the first thing to do. Like if you're unsure, get off your horse and have a professional be involved. And that might be your physical therapist that knows your horse, or it might be your farrier, or, you know, like having an outside perspective on what you're feeling is a really good starting point. And, you know, I think do no harm is sort of the first, like saying that I'll go to, as hard as that is sometimes.
Yeah, absolutely. And I think that goes back to that guidance point. Like I've been part of the rehab journey of, I don't know, hundreds, thousands of horses. I don't know, not thousands, probably hundreds, but lots of horses. And it's always absolutely dumbfounding how little information people are given. And, you know, myself, I am a professional doing this for other people. So obviously I know how to fill in the blanks, but for the average amateur horse person, you know, it's a really scary thing to be sent home with, for example, PSD, like with Blondie. You know, the information I was given, or the rehab structure I was given, was we medicate it, and then within 4 weeks, if we did surgery after the box rest, we would start walking and doing stuff. But they don't necessarily give you guidance around posture or relaxation being an important part of it. You know, doing things without training aids being important, so the horse really actually finds that shape in their body themselves. And I think it's so good to hear that vets are starting to qualify in rehabilitation, because we're all really good at like fixing it, but it's that longevity, that how is that going to carry forwards? Is that going to be a long-term solution for that horse? Because like you say, with the surgery, it looks like a mess afterwards, because if you don't change why it was happening in the first place, like the posture and the hay net that's tied practically halfway up the wall, and the bad foot posture and the gut problems, and then the bad saddle, and then it's got wolf teeth or one wolf tooth or something, you know, the up down in the feet. I could go on about the number of things that can cause back pain. Right.
Yeah.
And the spine, and like you're saying, the kissing spine, that is the thing, that the straw that breaks the camel's back. Right.
Well,
but
I think
if we don't mend the first things, you're not going to see the solution from the surgery or the treatment potentially.
And I think the thing with kissing spine is like it doesn't pop up overnight, right? Like you don't go out in the field and have a romp around and come in with kissing spines. Like this is something that is, you know, either, and again, like there are things that we don't know about kissing spine, but like it can be congenital, it can be, you know, degenerative. Like, so that finding is the first time you're looking, but who knows how long that's been there. So I definitely think that is just, again, the more we learn, the better we can do. And I don't think it's anybody's fault. Like, I think it's very challenging to image a horse's back. And, I'm very lucky in that what I do, I have MRI availability. I can look at things with a lot more detail. And unfortunately, just due to their sizes, like, it's going to be a long time before we are MRIing these horses' spines because we use human machines. But I think, it's just all about educating yourself. And going back to just a little bit on the rehab front, like, I agree with you, like, it's fantastic that there's more and more training programs for rehab, but like, I'll be very honest, like, this was not discussed in vet school. Like, there is only so much that you can learn in 4 to 5 years when you're studying all these species. And that's why I decided to specialize, because I felt like I wanted to like have more knowledge in a very specific area. But nobody knows all the answers. And I think that's why it's really a collaborative approach to the care of these horses, because you have to have not only the veterinarian, but the physical therapist and the farrier. And one thing I always say with back pain is it's never one answer. It's never just like, do this and your horse will be fine. Like, it is generally, you have to include different modalities to have a successful outcome. So that's really important. And then the one last thing that I will say, because you briefly mentioned this, is training, like, equipment. And I definitely, like, a lot of people recommend like the Pessoa and the Equiband. I don't know if it's called the Equiband over there, but like the elastic band that goes under their belly and behind their butts. And I don't usually recommend those because, unfortunately, I think most of us use them like incorrectly. And I think the horses have to develop their like normal movement patterns before you can influence them with training aids. Because a lot of people just like fit it once and then just like slap it on and lunge it in there, 10 minutes this way, 10 minutes that way. And I think it's hard with some of these like training equipments. I think they can have their place, but if used appropriately in the right time. And I find that there's just too much error when using those. A big favorite of mine, though, is balance pads. So I do highly recommend.
Who loves a balance pad?
Yeah. I think it's very unlikely that anybody would do any harm with a balance pad. You do have to listen to your horse because they do really struggle when you start this. But
and that's why you don't really do it tied up, right?
Yes. Yeah.
You want the horse to be able to walk on, walk away, make choices.
Make sure the horse is standing square. You can do this in the aisle or in the ring, to vary the like surfaces that are below the balance pad. But yeah, definitely. I think that's like, if people want like something, they can go home and strengthen their horse's posture with an easy exercise.
If anybody wants to learn about balance pads, I've got a few videos on my Patreon about it.
There we go.
But it is that standing on a slightly changeable surface while shifting the posture that is such a powerful change in a horse's body, right? Because it changes that proprioceptive ability. Is that why they're so good? Can you touch on why a balance pad is so powerful?
Yeah, I think the balance pads help work all the tiny little muscles, and these muscles are very important for stability. So I think that's a big portion of like, it. Like sometimes I use this example, but like, if you exercise yourself and if you put your arms to the side and like flutter them, it's probably like one of the most like painful exercise. Like your arms are burning after
so small,
like,
but it's so painful.
Yes, exactly. And then you go to the gym and you like get a barbell and you like deadlift or squat or bicep curl, whatever weight, and you're like, how is it so painful to just like flutter my arms in the air? And it's just like sort of that same concept as like these little muscles that you don't use all the time that could really help stabilize your joints.
I love that. I've got my closing tradition of question. If you had one thing that you could say to the equestrian community and every single person heard you, what would you say?
I would say listen to your horse. I think that is a really big one. And being a veterinarian and also a show jumper that, I do enjoy riding my horses, and I do enjoy the performance side. And I have struggled with the line of performance and welfare and good horsemanship. But I think it always comes down to listening to what the horse is telling you.
Fantastic.
Brilliant. Absolute mic drop. Thank you so much, Daniella.
Of course. It was so much fun. I love listening to all your podcasts, and it's just so fun and easy to chat with you ladies.
Oh,
well, thank you so much. Like we said before, we will put all of Daniella's information in the show notes. If you have any questions or you'd like to get in touch to maybe discuss a consultation for equine back pain, then I think Daniella would be happy to help.
Absolutely.
Well, thank you so much, Daniella. What a fabulous conversation. It always feels like we have these serious topics, but we always end on a really hopeful note, and hopefully you found it interesting to listen. So thanks for tuning in, and we'll see you next week.